Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. Today, Texas 2036 founder and chairman Tom Luce is joined by Dr. John Zerwas. Dr. Zerwas joined the University of Texas system as Executive Vice Chancellor for Health Affairs in October 2019. He provides oversight and guidance for the 6 UT system health institutions, one of the largest networks of academic health institutions in the country, with an aggregate operating budget of more than $14.7 billion. Prior to joining UT system, he served in Texas House District 28 for 7 legislative terms in the Texas House of Representatives. A physician for more than 30 years, Dr. Zerwas is past president of the American Society of Anesthesiologists. Tom and Dr. Zerwas will have a wide-ranging discussion on the future of Texas. Tom, Dr. Zerwas?
Thank you.
Thank you, and thank you, Doctor. I'll never forget the first time I met you. I traveled down to your district office and met with you when we were founding the Meadows Mental Health Policy Institute, and you were such a strong advocate for the medical community, the health community, mental health. I just always enjoyed working with you, and the legislature, we shouldn't let you go. I know the UT system wanted you badly, but you were always a steady hand of the legislature dealing with really difficult issues. So thank you for your service in the House of Representatives first. And I noticed I always admired, apparently you were able to have most of the scars where they didn't show from your legislative service. I mean, they were not visible. So I know there were numerous and a lot of bruises and scars, but you were very good at hiding them. So thank you for your service.
Well, thank you, Tom. I appreciate that. It was a privilege and an honor to serve. I was fortunate to serve under 3 speakers, during my time, Tom Craddock, Joe Strauss, and Dennis Bonnen. And they all put me in unique leadership roles, especially tapped into my background as a physician and somebody involved in healthcare. So I really enjoyed the opportunity that I had. And after 7 terms, it was pretty clear that, somebody else needed to pick up the reins and run with this. Although I would have been happy to have continued in that role. I think it was the healthy time for somebody else to come in, and I was looking for that next chapter myself, and that next chapter happened to be in an academic environment. And I think the role I'm in now sort of uniquely allows me to build and leverage my role as a practicing physician, a person who is involved in the healthcare environment from a chief medical officer point of view, as well as serving in leadership roles and stuff, certainly as an appropriator with the Texas House of Representatives. So it's a nice place to kind of bring all that your career together.
It really is, and I thought it was just a unique fit because, the ability. I remember you and I talked early in the beginning about the vision of how important it was to make sure that behavioral health and mental health was embraced by our academic institutions, our healthcare institutions that service our state. They're a huge part of our economy. They're a huge part of our future. So I think it was really a unique opportunity to combine all your expertise. So thank you for doing that.
Absolutely.
And then you get there and the pandemic hits and all of a sudden you're drafted into another position, which is part of I've been privileged to serve on the advisory council on the, I would say, the more business-oriented side of advising the governor, and then you and 3 other doctors have been advising him from a medical standpoint, and that's been a unique experience, I'm sure, as well.
It has, and I was very flattered and honored to come serve with the governor in this capacity, and the chancellor was likewise, very understanding and supportive of me, going and spending a significant amount of my time in this environment and stuff. And I would say, he brought me in initially as part of the supply chain strike force, if you will, and looking at trying to, build up our supplies of personal protective equipment, making sure we had, just adequate supplies of things that we needed to really hit the epidemic head on. And really, uncertain as to whether we would be overwhelmed by it, similar to what was happening in New York, but certainly preparing for that kind of event. As time went on, we were able to really solidify our supply chains. As time went on, we were able to realize that we weren't going to be hit the way New York and New Jersey and the Northeast was in general. And part of that was probably environmental, probably by the grace of God. And fortunately, with Governor Abbott's leadership, we were able to really kind of put these distancing and hygiene and stay-at-home orders in place that really, I think, tremendously flattened the curve and allowed us to be in a much stronger position than others had the opportunity to do so. But a big part of going forward was then, making sure our testing capacity was ramped up.
Can I interrupt there before we go to that second part? I have felt like one of the untold stories to the people of Texas really was the capacity of the strike force to meet the PPE needs. And it was not only you, but having the advantage of having Dell Technologies here in our state and their supply chain expertise of understanding the worldwide market. It just seemed to me it was a remarkable effort that, because we averted a crisis, was really not a big story. But it was really met in a very unique way that was a combination of the public and private sector.
Yeah, exactly. The governor was very astute in that regard and reached out to Dell, and one of their chief procurement people, Keith Myers, has been leading that team of several individuals, which has evolved over time. But as you pointed out, the initial effort was to try to tap into these various supply chains that they had a unique expertise for, especially when it came to those relationships in China. Now, not all of those things played out, as we understand, but clearly their expertise and their ability to work in this environment, but just their understanding of the logistics of supply chains and stuff was incredibly valuable. And then, a third person that was brought in on that initial team was Clint Harp. Clint was with the Lower Colorado River Authority most recently. And a very, very bright guy, very tech savvy kind of a guy who, really was able to kind of move us towards a tech solution to a lot of things. As you can imagine, we had supply chain people that said they could provide PPE just coming out of the woodwork.
Sure.
And, frankly, a lot of them just weren't credible. But, instead of us having to labor through those on a manpower point by point basis, he was able to set up a tech solution to that, that allowed them to be vetted a little bit differently and allowed us to focus on what were the likely successful supply chain providers out there, as opposed to the ones that just led to a dead end and stuff. So,
congratulations. I just really do think, and who knows what the future will hold, but I know everybody was concerned at the beginning to make sure we were not New York, not Northern Italy, and at least the first set of the spike we were able to handle from an equipment standpoint. And then as I described it to again my grandsons, it was you can close an economy by executive order, or the government's pretty good at closing something down, but then how you figure out how to open it up safely, which has been an interesting process to watch, and you had a front row seat on that, and it's a difficult process to think through all the different types of businesses in a diverse state like ours. How did you feel at the beginning about the task of undertaking that, and again, to do it safely? I mean, you're threading a needle. Nobody's ever done this before.
Yeah, and Commissioner Hellerstedt puts it well. The Department of State Health Services Commissioner, he says, we are threading a needle, but our hope is that as time goes by, the eye of that needle gets bigger and bigger, so it's not quite so difficult to thread things through it and stuff. But initially, that's exactly the case. But I would say this, the governor established a Reopen Texas strike force that James Huffines is chairing, as you know, and really they're the ones that have probably the bigger job in saying, okay, where's the best place to start, and what are the businesses that we can sort of wade into and get some experience with, that will help us, kind of feel this out as to whether we're doing it right or not. And so myself and the three other doctors that are involved as the medical advisors, we just simply wait for the strike force to bring us the proposed businesses to open. We basically apply, the four of us, our knowledge and our perspectives as to what's a comfort level in terms of opening up the state's economy. And over time we've become very familiar colleagues. It is not a groupthink at all. I will tell you, it is one that there are those that are much more conservative leaning in terms of being, in terms of what there's a willingness to open up and how much they're willing to open it up. And there's others that are probably a little bit more willing to try to stretch it a little bit farther and faster, because just a sense that at the end of the day, it's going to be people's behaviors that makes this successful, not proven necessarily. People are going to have to understand that all the things that mitigated, the effects of this virus in our state and in our communities was people doing the right things. Now, part of that was staying at home, but that wasn't solely the part of it. The biggest, in my opinion, the biggest part of it is we understood the importance of social distancing, which doesn't mean you have to be holed up in your house. Doesn't mean you can't go to a grocery store or some other kind of essential service, if you will. But it does mean you have to be, respect distancing. You have to respect the use of cloth masks. You have to respect, personal hygiene and hand hygiene, especially, in order to safely get back out there and do these things and stuff. If people were to say, the heck with it, I'm going to go participate in some large congregation of people, whether you have masks or not, then that's likely to set off a spread that could be difficult to contain. So it really all falls just like the success in keeping this virus damped down was really the investment that Texans made. Similarly, the opening up of the economy is going to be the investment that Texans make in adhering to these practices that will allow us to safely open our economy, but yet at the same time live with the burden of virus that we're going to have for the next several weeks and months. And we can do that, and I would say, in fact, we have to do that. There are health consequences, both mental and physical, that come with an incredibly stagnated economy, as you and I both know that. And so it's really not an option. It's something that we have to do.
Yeah. It's just a question of how we do it and how people respond to it, because the economic consequences of this have just really been severe. I mean, that's not a news bulletin. All you have to do is look at what's happened to the unemployment, which is just tragic. The numbers, the fallout of this has just really been severe. And along those lines, I know that you, based upon your legislative work, you're very familiar with several issues which are of great concern to Texas 2036. One of them is rural health care. The other is access to health care. And, I've been very concerned to observe, with the unemployment situation, a lot of people who have historically had private insurance all of a sudden may have the right to buy from their employer coverage for a year, but they may be unable to afford it, which is just going to swell the strain on the healthcare system, which in and of itself, I think most people are beginning to realize, although they had to respond in heroic ways to the COVID, the impact on the rest of the healthcare system has been very severe. So we're going to face some real challenges on the road ahead for our healthcare institutions, are we not?
Yeah, we are, and I'm glad you mentioned the rurals, because their margin to survive is much less than, let's say, somebody in Dallas, Fort Worth, or Houston in the Texas Medical Center that probably has, to a large extent, enough reserves or capacity to ride something like this out. The one thing I have observed, and obviously being very close to healthcare, is how quickly they can ramp back up. So as quickly as they shut down and created capacity and preserved PPE, they have been allowed to kind of ramp up about six weeks later. I would say that most of the healthcare systems in the large metropolitan areas are functioning at 100% of their ability right now, knowing though that they have to reserve about 15% of their capacity for COVID-19 patients. And so that's just simply to say, if we start to see, a real surge in this activity, there will be an expectation that healthcare systems can surge into additional capacity in order to accommodate that. And we watch that very closely at a state level and on a regional level. And even when there's some signals there that says there might be somebody getting into trouble, like for instance, recently El Paso and the Amarillo area, we'll do some call-ins to those areas of the CEOs and the healthcare leaders in that area and find out, okay, are things okay in your particular area? For instance, I did this on Sunday, Tom. I had the Department of State Health Services call me. They had gotten a call from the White House that registered some concern with El Paso and some of the numbers that they were seeing. Our numbers similarly said it is looking like it could be getting a little tight. And so, they asked me to call in to a few of the CEOs, which most of them I know through one capacity or another, just to say, hey, how are things there? How is your capacity? Do you think you're going to be okay for the next week or two? And that's an invaluable thing to find out and stuff. So, yeah. And so, like in that case, they said, well, we're busy. We're not threatening to have to open up any alternative care sites like using motels or branching out into like an ambulatory surgery center or anything like that. But they said, we're kind of expecting their peak next week, which would be next week. And once they got through that, they really felt like they were probably going to be, in an even more comfortable place. But there's nothing like talking to the people on the ground who are living this, hour by hour to find out, hey, are things okay? Do we need to float in some resources from the state perspective to help you out, which obviously takes a little time to get those things stood up.
You bet. And for our viewers, I'd remind everybody you can go to the Texas 2036 site and see our dashboard where we track hospitalization capacity county by county, trauma service area by trauma service area. And it's a very important indicator when you're looking, because regardless of the arguments about how many tests were given and all of that, I mean, ultimately we have to make sure that our healthcare system doesn't crash. Well, and that's an important factor.
Yeah, I'm glad you brought that up, Tom, because that's something that I think we always have to go back to. There was, an interesting phrase that somebody said at one time. I think it was somebody very frustrated with the fact that the healthcare or that the economy wasn't opening up. They said that, the initial mantra was to flatten the curve. And they said, it now seems the mantra has gotten, wait for the cure, and you can't let your economy sit stagnant to wait for a cure or to even wait for a medicine that might treat this, And so, we have to go back and remember the purpose of flattening the curve was to protect the integrity of the healthcare system. And I, like you, one number I follow very closely is the number of people hospitalized on a day-by-day basis. And that has very consistently been between 1,500 and 1,800 patients a day over several weeks, well below the capacity that we have in our healthcare system. In fact, you could easily double that and still have substantial capacity in our healthcare system to take care of COVID-19 patients. Now, that only matters on a regional basis, for instance,
trauma service area on our map.
For instance, out in El Paso, where that's kind of the only game in town out there, it's hard to get additional resources there if they get into trouble. And so some of these areas like El Paso, Laredo, that might be a little bit harder to reach out to, you watch perhaps even a little bit closer, just knowing that it takes more than a day or so to get resources in place that they might need.
Well, as we think about wrapping up this conversation, how do you see the next couple of months unfolding, and what would you say to Texans in terms of what we can all do to make sure we're doing this safely, but realizing, it's not lives versus livelihood. We have to get the economy moving as well.
That's exactly right, because livelihood does have a significant effect on lives, and so we can't forget that. And so it's absolutely incumbent upon us to, really kind of foster the opening of the economy, not push it at a rate that causes things to break by any means, but that we continue to do that in a way that we continue to mitigate the effects of the virus. The best things that we can do individually is to practice good hand hygiene, good principles of good, public health in general, wearing masks if you feel like you might get into a congregate setting whereby you can't.
I want you to see my mask. I want you to see my mask, John.
I like it, man. You've always been a guy of fashion, and so that's perfect. So, but keeping the distancing. One of the most important things I think we can do is to try to avoid these congregate settings. Now, we all recognize the nursing homes are really just, very, very susceptible to problems with this. The elderly account for half of all the deaths. The nursing home deaths are about half of all of our deaths. But these congregate settings like meatpacking, like our prisons, like the nursing homes, those are examples of congregate settings, and we have to really recognize the importance of avoiding those out there in the economy. So, packed concerts, stadiums full of people, those are going to be tough things for the next several weeks or months until we can actually create that herd immunity, as it's called, either through vaccine or through exposure. If we don't do it through vaccine, it's going to be a much longer slog getting there to get that herd immunity. Vaccine will get us there very quickly once we get that in place. So, but the best thing we can do is the things that all of us know were important to get us there. We don't have to stay cocooned in our homes unless you're somebody that's at high risk for some kind of effects of COVID-19. But we need to go out and be very, very aware from a public health point of view, and just practice and demonstrate and amplify all those things that we know will make a difference.
Well, thank you so much again for all your service in so many arenas. I think, you, because of your prior experience, are uniquely positioned right now to be really a critical resource for our state. And so we thank you for your service. And I hope all Texans will listen to your advice and counsel. I know we were told early in the Governor's Advisory Council that although we were asked to make suggestions and recommendations, it was all going to be run by the medical experts. And I think you all have done a good job of laying out the guidelines. We're grateful for your advice, and thank you for your service, and thanks for being with us.
Thank you, Tom, and thank you for all your leadership and the many, many things you've done that have benefited the state of Texas. Thank you so much.
Thank you.
Thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email us at straighttalk@texas2036.org and follow us on social media and sign up to receive our emails. Visit texas2036.org for more information. Until next time, wishing you and your family well.